Life on the street is one of the hardest things for these guys. There's a lot of uncertainty of where you're going to sleep at night, where your next meal is coming from, or are you going to be wandering the streets? It's a day-to-day struggle.
Our ER sees about almost 80,000 people a year. Probably 5% of the people that come to the ER are homeless.
They use ER as primary care because they don't have primary care physicians.
We would see homeless patients with the same issues over and over again. A lot of wounds, a lot of people with cellulitis, which is a soft tissue infection usually caused by a wound.
Broken bones, just uncontrolled diabetes, and a lot of kind of chronic ignored issues that just kind of come to the surface.
They would get discharged from the ER, they would go back out to the street, and the initial problem that they're seen for at the ER has then become something that requires hospitalization.
But we'd see them over and over again if they were homeless because they just never convalesced at home and got better.
When I was getting my bachelor's degree in nursing here in Spokane, I had worked downtown as a clinical rotation. I was working with a lot of the homeless services downtown, and we had a lot of people that we were serving that had come out of the hospital or needed to be seen at the hospital, but they didn't have a place to go rest because the shelters are closed for a certain portion of the day.
What do you rate your pain at right now on a scale of 0 to 10?
And it was during my master's that I came up with the idea for the program.
The idea being, how can we have a spot for these men and women who are homeless and in the hospital and ready to be discharged, but they don't get discharged because they have nowhere to go.
I approached House of Charity, Jean DeRay. I said, here was my idea, and is it crazy or what? And he thought it was a great idea.
You know, interestingly enough, House of Charities has been doing respite for many years, but it was very informal. And the folks at Providence saw what we didn't see, which was, hey, that's not a bad idea. And how do we do this on a bigger scale?
It was just myself and an agreement with House of Charity to host a bed, one male bed, and I would get a referral from the hospital, social workers here at Sacred Heart. We would make sure they were connected with primary care, and they would stay in that respite bed until they were medically ready to be back out on the street again. Dr. Nevin approached me with the thought that maybe my program, the respite program, could be expanded.
Becky Doty and Dr. Nevin and Rob McCann came to me to discuss whether or not this was something that the Providence Healthcare Foundation might be interested in starting with seed money. One of our members of the Grants Allocation Committee is actually a retired nurse, and she really became a champion for this project. She really got behind it and talked to the board about how important something like this was.
The care at Respite is not intensive nursing care. It's meant to be the level of care that you could probably give yourself at home. There is a nurse there that does a lot of engagement with the patient, that tries to get them to understand how to take responsibility for their own health care and their own medicines.
Health is not just having good blood pressure, having good vital signs. Someone's health is a lot more dynamic than that. It's their mind, it's their body, it's their spirit.
It's very holistic. She's really down there making sure that while their physical body is healing, they are being connected to other resources.
They can meet the social service people they need. They can sign up for housing programs. They can get an ID. They can get prescriptions filled. They can get their wounds dressed.
Once you house a person, that relieves a large portion of their stress. The addiction issues slack off a little bit more, and they're able to heal better.
Providence had this great vision and took this great leap of faith to turn, one respite bed into 2, into 5, into 7, now into 9, and that's success.
The hospital saves money, the doctors are giving good care, and they have better outcomes.
Housing is like one of the best treatments we have in all of medicine. It helps a lot of problems, and we really need to recognize that we need to be able to write a prescription for that housing and have some place that can actually fill the prescription and keep filling that prescription. Otherwise, people are not going to get better.
These are folks that are the most fragile, the most vulnerable, the most at risk among us. And they need the most care, and they need the most compassion.
If you just have one person who's willing to make those relationships happen with other people in the community, with the hospitals and with other service agencies. This could be done anywhere.
It's improved so many people's lives. I've seen a bunch of guys come through the program in the past year that if they didn't have it, some of them would have been dead.